Hi everyone, my name is Oluwatobi Oyanike, and with me here is Lucy Dula, professional health informatics specialist, here to talk to us about an incident that happened at the academic medical center where some staff and patients complained about miscommunication. And Lucy here is just going to talk about it more and explain further and just share the view and possible solutions to work with the preventer it in the first place. So here you go, Lucy.
So hi guys. So what happened was that this was from a medical center. We were trying to implement our phone system to go live with our EHR. And our purpose, the goal of that was to improve the access of the secretary to the patients faster, so they can have access to their physicians quickly.
So what happened while you were trying to implement the system? What went wrong?
So what happened was the phone call, some of the patients are not getting the call when they try to call on the message. The message is not recorded.
Okay.
Also, when they try to call, it would direct them to somewhere else other than where they go.
So it wouldn't get to the physician?
No.
So just go somewhere else?
No, it would just go to some random places.
Okay.
Also, secretaries were not included, and the secretary were not included in the training, and doctors were not fully included in this process as well. Also, they did not tell the public about what they were doing.
So the patients didn't even have any idea what was going on?
No, the patients have no idea.
That I can see why the patient were complaining. So they didn't even know what was going on. They were just trying to attempt the old way you used to talk to your physicians. You try to connect. That's what happened.
Yeah.
So okay. So what would you have done to prevent this from happening? Before we get there, wait, you said the doctors weren't fully involved.
Yes.
Did they know about this in the first place?
They know about it in the first place because the medical center told them about it. So they told them, we were implementing a system, blah blah blah.
So they didn't know the level of they didn't know how big the system was going to get.
No, they did not know.
I see. And so if they didn't know, that was definitely they were not trained.
Yes. They were really undertrained actually.
Oh, okay. So what would you say? What would you say? What would you do to prevent this? As in health informatics, what would you do? What would you advise?
I would advise them to think of a customer first. They should have included them in the first place. They could have conducted an opinion survey or some sort of place to include their opinion about this new system, so they know what is actually happening.
Especially because of the fact that the patients are the main. The patient is the main goal, right?
Yes,
to provide access
audience towards this situation. Yeah.
And they were not even involved.
No, not in this implementation anyway.
Okay, so what else happened? What other solution would you say?
I would say evaluations for the system.
What do you mean by evaluations?
So before they implement the system, they should evaluate the system to see what is wrong and see if there's any errors in what is going on. And if they do regular checkups, they should prevent this whole problem altogether. Even if they don't tell the customers, they should at least make this problem better.
Okay, I see. What? Do you have something else?
Yes, I think because the staff were on the train, they would provide more training for them. If they were more trained, they would have more knowledge towards the situation.
So I have an idea. Is that okay to share? I feel like a direct phone line to the doctor himself should be okay.
Yeah.
Like rather than get to the secretary at times,
maybe
they should have like an emergency phone call where it goes directly to the doctor.
Yes, that would be a solution, but also if the doctors get too many phone calls at a time, he or she will be overwhelmed by the phone calls. And I think it would be a good idea, but only I feel like in emergencies only to have the phone call to go to the doctors instead of calling the doctors all the time, because that's what secretaries are for. They are here for to make phone calls so doctors doesn't have to deal with all that mess.
And so what do you think your solution would bring? What are the impacts of your solutions right now?
So some of the concerns are the staff that were trained. If we ever retrain them, it will cost more money. Or if we hire more staff, it could also cost more money.
So more money would be spent either way. So okay. What other things?
Customers do not like change. They would resist to change, and it would be like they would not like what is actually happening. If even you tell them about this beforehand, they would not like that.
I know, because no one likes change, right? You're used to something, you keep wanting to do that thing, but like at the end of the day, it's to improve better care to the patient, right? Yeah, no one likes change, but it's going to be hard for people to get used to, I guess. Okay,
there's one more which it will slow down the workflow, even because with the doctors and the staffs will not be able to do as much work as before. It would not be able to do as much work before using the resources now because they don't have the full knowledge of what is going on.
Also, you're getting used to it.
Yes, you need to get used to it, and then that means slower workflow.
Okay. Where would you say this has happened? I'm pretty sure this isn't the only case this has happened.
Yes,
Do you have other scenarios where
this thing has happened worldwide, including Canada, India, and UK.
Okay.
So in Canada, there was a place in dental clinic.
Okay.
They were trying to improve their high call volumes and also improve their customer service. So with their systems, with their new system implementation, they were able to improve their call quality and improve customer service. In India, they were trying to implement a system to establish connection between two major hospitals, which they were able to, and they were able to reduce the cost by 45%.
that's good.
Yeah, it is.
Okay.
In UK, the GP Care Clinic, they were collaborating with Exxon, which is a call company.
What?
A phone company.
Oh, okay.
And they were trying to implement using their new system so they can better their call quality. And it was successful in the end because they actually had a really successful relationship.
So, what made all these three different things successful was following. Was it associated with the solutions you just said?
Yes. So at first they include more training for the staff, of course, and they also had better system.
Like what? Sorry, just repeat yourself.
So they had better staff training,
okay,
and they also informed their customers and their patients.
Also, the patients were ready for the change.
Yes, they know, and then they even give opinions about how this was supposed to work.
Okay.
Also, secretaries and doctors were more trained.
Yeah. So the lack of the training and information and involvement of everyone was what caused the consequences, or what caused the problems, the major problems in the academic medical center where you're working right now.
Yes.
Okay, so just need to implement what you think and everything will be better, right?
Yes, hopefully.
Alright, thank you so much for your help, and
no problem. Thank you for talking to me.
Yeah, you're welcome.